Today, we have a very special guest on for the VLU Voice. Dr. Steve Elias is the director for the Center for Venous Disease at Englewood Hospital and Medical Center in New Jersey. He's the founder for the American Venous Forum Fellows and Residence Course in Venous Disease. He has lectured extensively nationally and internationally, and is the founder for the annual Expert Venous Management Summit, which is an amazing course. He's the medical editor for the American Venous Forum newsletter, The Vein Specialist, and the co-founder for the video online magazine, Venous Edge, and is the principal investigator on multiple clinical trials. So Dr. Elias, on September 19th in 2023, you're going to be having a series of sessions at the AVLS meeting that are looking at emerging technologies. How did you think of organizing this course, and how did you put it all together?
Yeah, so I mean, this is for the AVLS, or actually the UIP meeting, which is going to be held in Miami in September, and it's just part of the entire course. And we're going to have on that Tuesday, the 19th of September, a full day discussing various emerging technologies in the vein world. And you know what I always thought, I mean, at least to me, the exciting part about treating vein disease, yeah, once we kind of have our techniques down, we do them and we all feel comfortable with them. But I'm actually always looking at new things, what may be on the horizon, and what others may be interested in a way that helps the patients, but also makes our job a little easier. And that really was the whole concept behind this, to find things that are just out there very recently, or things that aren't even out there yet, but may be coming out there. And that was the whole idea.
So what are some of the areas that are being explored the most, and what are some of the areas that are being explored the least?
Right. So, I mean, all of us in the vein world know, I mean, honestly, in the beginning, the hot thing was, um, superficial axial disease. That's where we all started with endovenous ablation and various types of ablation technologies. And, they've been getting better. They've been improved in terms of the way we do that, whether it's thermal or non-thermal. And that was kind of, I thought, where we were innovating early on in the beginning part of the 2000s or so. But really recently, that's kind of like, bread and butter, run of the mill. Anybody in venous disease knows how to manage superficial axial disease, saphenous incompetence, great or small or anterior. And the areas that really are kind of hot right now, we all know thrombus removal in some manner or means. There's enormous amount of technology that's been recently developed, both using the thrombolytic agent, mechanical agent, or a combination thereof. And there are newer technologies coming out that are a little bit different in that realm. So hot topic is acute thrombus removal. The other hot topic is chronic disease removal. And I don't want to call it chronic thrombus because it's not. It's post-thrombotic disease. And that's another hot topic. We're all getting pretty good about taking care of an acute DVT with various technologies we have. But really the chronic disease is something that still we have trouble dealing with in terms of getting it to be good inflow into, say, an area that we want to stent, the iliacs above, or primary disease in the infrainguinal area, post-thrombotic disease. So that's one hot topic. The other hot topic is the PE. That's again is something else. We're all know about PERT teams and how important that is, but there are newer technologies coming out that can take care of the problem in a quicker manner. That's another really hot area of innovation in both physicians, inventors, as well as companies. Now, you want to talk about what's not being okay. So one of my pet peeves has been that the smaller the vein, the harder it is to treat. Big veins, we got no problem. Thrombus in a big vein, refluxing great saphenous vein, we're good with. It's really the smaller telangiectasias, reticular veins, which we've been doing the same thing for many, many years, using similar, technologies and techniques. And none of us are really like thrilled with the results. We kind of, we can do the same thing on the same patient, in fact, on two different legs. One leg may turn out wonderful, the other leg may not turn out as well, or certainly on different patients. And an area that none of the nobody seems to be focused upon is really, the small veins and the cosmetic veins to get better results. So that's something that still is out there. So those of you who want to be included in the next time we do the emerging technologies, start thinking of ways or techniques that we can get more predictable results for small veins in the great majority of people. I mean, I don't know, what do you think about that, Anil? I mean, don't you think like small veins, we're less certain about the outcome as opposed to somebody who has a 8 millimeter refluxing saphenous vein with varicosities? We know what we can do. We can tell them, hey, you're going to feel this much better.
Absolutely. I think there's a lot of room for improvement, which makes it the challenge, but also makes it, as you said, the opportunities that are available. And I think there are lots of opportunities and challenges that are available, including the small veins, because a lot of the technology we're using for the small veins is pretty old, and there are lots of problems and areas for improvement. So I do think that there are clearly some areas that we can improve on. So some of the technologies have agreed to participate with this particular session, the series of sessions, but some didn't. And why did some of the technologies didn't want to participate, and what were the reasons?
Yeah, the main reason, I'm not going to tell you the technology that don't want to participate because they don't want to participate, so we're not going to say anything. But it really is, most of those were coming from um, the larger companies, the bigger companies in the vein world that are developing, proprietary technology to take care of things. And they thought it was kind of too early to let their ideas out for, I guess, their competitors to see what they're thinking of. And that's really where I got some pushback from them. And I really try to, and again, a lot of them, and similar, one company may have one or two in the emerging technologies section, and they may have held back on one or two others of their emerging technologies because they felt it was just not far enough along yet that they didn't want the world to see it. But I can understand that, and I kind of get it. But the smaller, startup companies were obviously very happy to have their technologies highlighted. And I said to everybody, you don't need to have data. That's not what we're looking for here. Data would be fine. Preliminary data is fine. But more importantly, we wanted people to understand and see what's going to be coming down the road, and where, technologies may need others to do clinical trials with their emerging technologies. So this is not a, purely academic session where you're going to hear a lot of data and, long-term data from a large amount of patients. What you're going to see is what I think is really the exciting part of vein disease and the vein world is like, what's next? What's coming down the line? And, my approach has always been, I mean, in the vein space and even in life, and many of you have maybe seen this because I use it a lot when I give a talk or whatever. It's really, respect the elders, embrace the new, and encourage the improbable and impractical without bias. And if you take that attitude towards things, you're really going to be able to make progress. The last thing we want anybody doing is saying, "Oh, that's not going to work. I'm not even going to try it." I just think that's not a good attitude. And that's really what we want to highlight in this session. Here's what's new. It may not work, but let's keep an open mind and see maybe where it might work and where it would be appropriate to help people. I mean, that's how progress is made.
Absolutely. So, which technologies or venous pathologies are not addressed in the session because there are no really emerging technologies to treat it?
Which pathologies?
Sure.
I mean, the one I told you already is the small veins, although we do have two technologies that are can be used for small veins, and that's the Varixio device that makes various concentrations of foam, which is, can be used at very low concentrations for the small veins, and there's a number of pretty unique technologies for perforating disease, which again is a small vein in general. I mean, it's maybe 3, 4, 5 millimeters at the most. So I guess there are some for small veins. Um, what is not being addressed? Uh, Otherwise, no. I think I honestly, Neil, I think we have. I think we've covered everything from the biggest phase, from the newest stents that are out there. There's trials that are just beginning. For instance, with a Gore stent, with a inferior vena cava dedicated stent as well, down to the really small vein. So I think we're actually doing pretty well, even for, as I said, for post-thrombotic uh, chronic disease. There's a number of technologies that are working on being able to get better results, whether it's the bullfrog technology, uh, that again is going to be there. The other thing before we forget is we're encouraging, and the great majority of the companies will have their technologies there so that after each segment, there's 3 segments, each an hour and a half long, during the course of the day, that you can get your hands on these new technologies and see what they look like, and speak with the various representatives from each company. So it's not just going to be something up on the slide. It's going to be something that great majority of the time you're going to be able to get your hands on as well, and interact a little bit more with the either the inventors of the technology or the company that's developing the technology.
I like that interaction, the new cutting edge and some of the new upcoming technologies and getting your hands on it, quite frankly, I think it sounds like it's going to be a great session. Congratulations and looking forward to it.
All right, so
Thank you.
everybody come to UIP in general and come to the Emerging Technologies on September 19th during the UIP meeting. And hopefully we'll see you all in Miami. So again, Anil, thank you for having me on this.
Thank you.